Morning, Adam. Okay, good morning, everyone. Happy Monday. This is Adam Mayberry with the Joint Information Center, respond to the COVID-19 outbreak here in Washoe County. Appreciate you joining us. Again, it's Monday, May 4th, coming off of the weekend. Not sure what happened to April. Given that it's May, I would be derelict in my duty if I didn't remind everybody that May is Wildfire Preparedness Month. And there's been some speculation that maybe with everybody staying at home that the wildfire season won't be as bad. And certainly from a fire service perspective, we don't necessarily submit to that. Want to remind everybody to avoid outdoor activities that could start fires. That includes target shooting, off-roading. Be prepared with the fire extinguisher, a shovel, small tools, some water in the event that you do spark a fire. Know that myself, my fire chief, Charles Moore at Truckee Meadows Fire and Rescue, or some of the other fire chiefs and regional fire service agencies, Sparks, Reno, are available to talk with you more on camera, on the phone, through virtual conferences to ensure that our community is prepared for the wildfire season. Certainly the COVID-19 pandemic has created some challenges when it comes to evacuations and sheltering, those kinds of things. So continue to want people to be mindful that we are moving into the wildfire season, to be vigilant, call 911 if you see smoke, and avoid outdoor activities that could spark a fire. Thank you for listening to that. I'm going to transition to our health officer, Kevin Dick, who will provide an update on the COVID count cases coming off the weekend, where we are today, and any further questions you have, including our ramping up our testing capability. Then we'll adjourn and we'll come back on Wednesday. We're looking to get a representative from the business community to address us. We may also have Dr. Pandore with us again as well. So today it's a health officer. Good morning, Kevin.
Good morning, Adam, and thanks everybody for joining us. I'm going to begin with addressing a letter that was distributed by Dr. Todd and covered widely in the media yesterday. And I issued a statement in response to that. It's been covered as well, but I just want to read that for you. As the district health officer, I must make decisions based on what is best for our community and the organization. I serve as the health officer because I was requested to do so by the District Board of Health in 2013. I have a 34-year career dedicated to protecting public health. It's unfortunate that, I appreciate everything Dr. Todd has done in his 14 years at the health district. It's unfortunate that he fails to recognize the expertise of the epidemiology staff and the hard work that has been done by the entire health district. I will not comment further on this matter as I am focusing my efforts on responding to the COVID-19 pandemic. So that will be the end of my statements in regard to that. I'd like to begin the regular briefing to provide you an update on our COVID numbers. And sadly, I am reporting that we've had another death from COVID-19 in the community. This is a female in her 90s with underlying health conditions. This is our 34th COVID-19 related death in Washoe County. In addition, we've had 400 total COVID-19 recoveries and 11 additional positive cases that we're reporting today. That brings our total COVID-19 case count in Washoe County to 988, our total deaths to 34. We have 18 additional recoveries, so a total of 400 recoveries. We have 555 active cases. We have 55 individuals that are currently hospitalized, and we have 72 people that have been discharged from the hospital. Our hospital capacity remains good. We have 57% of our short-term acute care beds occupied. We have 54% of our intensive care units occupied, and we have 15% of ventilators in use. I want to remind everyone of the importance of continuing to practice social distancing measures, of staying home when you don't need to be out, in order to protect yourself from becoming infected with COVID-19 and to prevent others from being infected with COVID-19. On Friday, we had reported 48 additional cases of COVID-19 occurring in the community. And then the last couple of days, 28 additional cases on a daily basis. So I'm very pleased to see that our new cases that we're reporting today are at 11, because it's unsettling as we are working through the plateau of cases and working to try to see a reduction in cases as we move forward in our response to the pandemic. It's unsettling when we see those increases occurring. I'm sorry, I have an incoming call that's going to ring, I think, for a few minutes while they're getting to my voicemail. It's very important, if we want to be successful in reopening our economy and getting businesses open and people back into those businesses, that we have to be careful that we are protecting one another into the long term as we're moving forward with this until we have a vaccine available. So I think people may be becoming a little bit more relaxed and have lost some of the focus initially on how they're protecting themselves and others. I think it's very, very important that we continue to remind ourselves and emphasize the importance of those practices for us to be able to move forward and succeed in our response. With that said, we have an important holiday coming up tomorrow, the Cinco de Mayo holiday. It's celebrated by many in our community. And as those celebrations occur, I'm urging our community members to do so safely. It's an important holiday for many people, but we need to change the way we behave and interact together while we have the COVID-19 pandemic going on. So if people can continue to practice social distancing, celebrate with close household members that you live with, celebrate remotely using social media, et cetera, but celebrate in a way that protects you, protects others, and keeps our community moving forward in our response to this. We have also been working to expand our COVID-19 testing capacity. And over the weekend, we reconfigured our drive-through post to add additional sample collection stations to that. This will provide us with the capacity to be able to test up to 900 individuals in a 4-hour period. We operated the post this morning with all 6 of the collection station staff to test that and how it's performed. I have not yet got a final tally on number of people tested, but we knew that we were going to be testing around 200. We didn't have a full capacity through the post today. But we have distributed a number of tests to partners in our community as we expand testing to include asymptomatic individuals that are in certain frontline professions and vulnerable populations. So we've provided over 300 test kits to our long-term care facilities that we have in our community, and are continuing to work with those to provide additional testing through their facilities. We have provided test kits to the Washoe County Sheriff's Office, and today we provided test kits to Reno, City of Reno, for law enforcement and fire responders. These are tests that are being analyzed through a commercial lab that's working with us, and we expect to have several thousand more of those test kits arriving tomorrow, and we'll continue to distribute those to those populations where we want to ensure that everyone is being tested, and that from there we'll also work with some other vulnerable populations. I failed to mention we also provided those test kits to Jan Evans to be used for their staff and people in that facility. So I think as we move forward, you'll be hearing more about the expansion of our testing capacity, but we're focusing on the criteria that the state is outlining for us for the priority populations for that testing. And the Nevada State Lab is continuing to work to increase their capacity for testing. So we hope to have that online by the end of the week if their plans work out. And we also have positive news with the manufacturing through 3D printing of nasal swabs that we can use for the specimen collection. Those have been validated, and the quality assurance, quality control has been done on them, and we expect to have a continuing supply now of the nasal swabs that can be manufactured through the university medical school. So with that, I will, I guess, a reminder, while we're expanding the testing for the populations I just mentioned, anybody that has symptoms, we have testing capacity for you. The test is free. Please contact us at 328-2427 or visit our website to go through the SurveyMonkey risk assessment to be automatically scheduled for testing if you have any symptoms. And as a reminder, if anyone has allergies that are more severe this year than normal, or if you have allergies this year that you haven't experienced in the past, please contact us and come through for testing in case that is COVID-19. So I'll end it there and open for questions.
Hey, Kevin, excuse me. Let me just get a question for Stanton Tang. He wants to know how many of the 34 deaths have been connected to nursing home patients.
I don't know on the latest death that we reported, but I believe that the last time that I looked at the tally from our nursing homes, it was 18 deaths, I'm sorry, it wasn't just nursing homes, but out of the state licensed long-term care facilities, it was 18 deaths, I believe. So a large proportion of those are out of those long-term care facilities.
Okay, thank you for that. My apologies for interrupting whoever was asking the question. I just had a check.
Yeah, and more limited person.
Go ahead.
Hey, Kevin, this is Kenzie with News 4. Obviously, with increased testing capabilities, you're going to probably get more positive cases. Can you just explain how that works with flattening the curve if we continue to grow by exponential numbers? How does that contribute to flattening the curve?
So as we increase testing, we will probably have more positive cases. But as we expand the population that we're testing, we would expect that the rate of positive cases would go down. So if we would, for every 100 people that we test, we would expect to have fewer of those people testing positive as we're increasing the population that we're sampling from where we began when we had a limited number of tests available, and we were prioritizing the most vulnerable people and the people with the most severe symptoms for testing. So as we open the testing up, we may get more positives because of the volume of testing that we're doing, but we'll also be watching for what the positivity rate is from those tests.
This is Paul Nelson with 2 News. Piggybacking on that, what would the long-term implication of that be? Will we start to see the cases eventually start dropping because of the more testing?
Well, the strategy behind this is if we can identify cases quickly with having people tested, that we can then identify who is positive and have them appropriately isolate so that they are not spreading the disease, and that we can identify people that were in close contact with them so we can have those people quarantine for that 14-day incubation period to see if they develop symptoms. So that will allow us to take our more traditional public health response of identifying the cases and then taking that appropriate action to isolate the infected people and to quarantine the people that might become infected so that we can monitor them and they're not transmitting the disease in the community.
Hi, Kevin. This is Lucia Starbuck with This is Reno. I have a question. I just wanted to make sure. So Post has capacity to test 900 people, but you're still only testing around 200 people per those 4 days?
So today we just had 200 people, and that's why we're asking anybody with symptoms to please contact us. We do have the capacity there. We also are still working with other of our first responders, and so we don't know for sure whether we'll be using some of that capacity perhaps for first responder testing coming through the Post.
When do you expect to be testing 900 people?
Well, that will depend on when the state's criteria for testing brings us that population to test. So what we wanted to do was ensure that we have the capacity for that testing. It's a requirement that the governor has for moving along with his phased reopening. The governor is satisfied that we have developed that capacity to be able to conduct those tests if we need to do so.
Hey, Kevin, this is Sam from the RGJ. Just kind of piggybacking off of that, how many people maximum could you test a day right now, regardless of what your capacity is at the Post? How much material do you actually have to use?
So we currently, I believe, had, hang on for a minute, let me see if I can find the 690 test collection kits that we had in our possession this morning before we began to run our specimen collection. The state has been working with FEMA, and we are receiving additional swab shipments from them, and with the lab having validated their process for 3D printing the nasal swabs, they say that they will have a manufacturing capacity of 1,000 swabs per day. So the collection has been sort of a limiting factor for us, the collection kits. And I believe that we will have that issue resolved here with the shipments that we're getting from FEMA and with the capacity that we're bringing online through the UNR's 3D printing. As far as the maximum capacity for our testing with our drive-through post, for that 4-hour period, it's 900. But if necessary, we could staff it for 2 shifts, one in the morning and one in the evening, which would provide us with a capacity of 1,800 specimens collected a day.
Gotcha. And just a quick follow-up, that number 690 kits, just to be clear, is that the total number of kits, the total stock of kits that you guys currently have, or is that just your daily capacity?
That was what we had on hand. So the total supply of our kits this morning was 690. The state lab has been resupplying us on the order of 200 to 300 collection kits per day. So as they increase their capacity for manufacturing those kits, we'll expect to receive more of those kits from them.
Gotcha. Thank you.
Hey, Kevin, this is Kenzie again with News 4. We saw that big spike on Friday in cases presumably linked to Easter gatherings. What does that do to the progress that we made last week? Does it erase it all and we start from scratch, or how does that work?
I think we just have to wait and see what develops. The concern is if we have that number of cases and they potentially were infecting other people, that we'll see an increase in cases that come out of those cases that were identified. But we'll just really have to wait and see. It's hard to predict where we'll end up, but it does create the potential that we start increasing our daily case counts in the future. But I'm pleased that we're reporting 11 today, and we hope we'll continue with a downward trend. But you know, the cases we had, we attributed some of those to gatherings that were held over the Easter holiday, and that's what makes us quite concerned with the Cinco de Mayo celebration coming up tomorrow. That we're hopeful that everybody can celebrate safely, so we don't have an uptick of cases that come out of that.
Kevin, this is On with UNR. I have a question about contact tracing. So does the Washoe County Health District make an effort to contact every person who tests positive for COVID-19? And then to follow up with that, do they then contact everyone that person identifies as a close contact?
Yes, we do. We contact every positive case, and we do an interview with them where we try to walk them back through everywhere they were from 2 days before they developed symptoms and who they were in contact with over that time period. And then we follow up with those people that they identified to us as their contacts, and we call them and inform them that they have been exposed to a positive COVID-19 case, and then we work them through what they need to do for quarantining from 14 days from when they had that contact, and monitoring their symptoms and reporting back to the health district if they do develop any symptoms. It's quite an intensive amount of work that is required with that. We are working this week. We're in a test phase for a software platform. Acela is the company that's providing it. It's a COVID-19 design platform that will help us more efficiently be able to manage the whole process, from people calling us at the call center, doing the risk assessment, getting scheduled for the testing, reporting back of results to those who've been tested, and then that contact tracing function as well. So we're hopeful that we can have that up and running Wednesday to facilitate our continuing work that we'll have with both testing and contact tracing.
Kevin, this is Megan Messerly with Nevada Independent. I had a follow-up on that on contact tracing. I just wanted to see what the status is of acquiring any additional staff or resources. I know there was some federal funding that you all were trying to secure. Just wanted to see where that is at.
So we are working on plans for staffing our contact tracing personnel into the future. We've been fortunate with the National Guard integrating with our staff that they've been able to help us with increasing our staff that's working on that contact tracing function. We've also had staff that have come to us from other parts of Washoe County, other departments. But as we get back into reopening our economy, we're going to lose some of those staff back to their department responsibilities. The Guard will be standing down in the future, and so we're working on our plans for filling those positions and having everybody in place moving forward. We're also coordinating with the state and the other health authorities in that process.
Hey, Kevin,
I
this is
one
Jim.
more follow-up. Sorry, I just had one more follow-up question.
Sure.
I know the counties were being asked on Friday to submit surveys or questionnaires to the new LEAP committee outlining whether they've met the criteria the governor has spelled out for reopening. And I'm wondering if you can just give us a sample of, where Washoe thinks it's met those criteria and where it still has some room to improve before reopening.
Well, I think that we provided a lot of information for that reporting. I haven't seen the final report that was submitted to the state, but I understand that it was submitted last night. And I think that the couple of areas, I think we have good plans in place for that contact tracing, and that was one of the areas that there were questions about. The PPE, I think that we have information that we provided as far as the hospital's PPE capacity and the PPE requests that have been received through our incident management team. But we don't have a full picture of all of the healthcare PPE needs in our community because a lot of these facilities, dental offices, et cetera, have been closed and have not been in communication with us. And then the other piece with the personal protective equipment is the supply as we reopen for everybody or in phases to reopen the businesses in our community because we don't fully understand at this point what the requirements are going to be in those businesses and what PPE needs there may be. So we provided the information that we have, and there's still some uncertainties about what the future need may be. And then on the hospital number of COVID cases that are occurring in our hospitals, it is not currently declining in Washoe County. It's been sort of flat with a little uptick perhaps, but I think that's one of the things we're also looking at. I think that the state has taken the position that they really need to look at these figures statewide. And I think there's a few reasons for that. Some of the information about number of cases that are reported to the state from the commercial labs, et cetera, coming into them, identify where the sample was collected, but they don't inform readily on whether that was a resident of Washoe County, or maybe somebody came in from Fernley and that's a Lyon County case. So it's important, I think, to look at the data more on a statewide basis, and also understanding that if we do have outbreaks that are occurring in other areas of northern Nevada, that those cases, if they become severe, are probably going to be ending up in our hospitals here in Washoe County, even though they're coming from other areas of the state.
Kevin, I was asked if we had the report that was sent to the state, if that's something that we could share.
I have not received a copy of the report that was sent to the state.
Very good, thank you. That was my understanding too. So it's about noon now. Any further questions before we wrap up for the health officer? In the chat, I did send you a link to, again, the media resource page. I still want to continue to push that out to you, and feel free to take any graphics, videos, PSAs that can help our residents understand social distancing guidelines, stay-at-home guidelines. We're not out of the woods yet by any stretch of the imagination, so continue to help. Ask for your help and support and getting the word out to people. Stay home, self-isolate to the extent that they need to. And we'll do this again on Wednesday at 11:30. If there are no further questions, we will adjourn. And again, as always, appreciate the generosity of the health officer's time. Okay, great. Thank you all. Take care.
Thank you.
Thank you, Kevin.
Thank you.